To help keep your patient's teeth cavity-free, recommend GC Fuji Triage, a revolutionary glass ionomer sealant and surface protection material. Now available in white, Triage is ideal for pit and fissure sealing. It can also be used for temporary filling of endodontic access, for treatment of non-cavitated lesions, such as toothbrush abrasion and root surface sensitivity, and it works well as an intermediate restorative material. A recent survey showed that 84% of caries in children between 5 and 17 years old involve surfaces with pits and fissures. The application of pit and fissure sealants is a well-established modality for reducing the risk and in many cases preventing occlusal decay. A goal of the U.S. Department of Health and Human Services is to have 50% of children treated with dental sealants by 2010. Let's first discuss GC Fuji Triage as it relates to pit and fissure sealants. Sealants are placed in the pits and fissures of posterior teeth. To be effective, typical sealants must have adequate flow, but are not necessarily runny. The sealant protects the tooth by keeping food and bacteria out of deep pits and grooves. Sealants that release fluoride are preferred, as they help remineralize the tooth, thus strengthening the enamel. Inform your customers that a first molar without sealant is 22 times more likely to develop caries than is a molar that is treated with a pit and fissure sealant. GC Fuji Triage, the maximum fluoride glass ionomer sealant, is the ideal product for performing pit and fissure sealant procedures. Its convenient pre-measured capsules and capsule applier make it simple and easy to apply. It can be brushed in with a microbrush or blown in with an air syringe. What hygienists, dental assistants, and dentists like most about Triage is that it stays where it's put, without running, and requires no etching. Triage sealant comes in pink and white. Triage Pink offers a visual indicator that is ideal for newly erupted molars. GC Fuji Triage White or Pink are the only products that can truly seal and protect partially erupted molars that are hard to reach and impossible to keep dry. Most resin sealants are not as effective because of their inability to bond in a wet field and maintain a leak-free seal during the maturation and full eruption of the tooth. What differentiates GC Fuji Triage from other sealants is that it can be used in a wet field, and no isolation is required. Because it's a true glass ionomer, GC Fuji Triage chemically bonds to the tooth for a strong, lasting bond. Its tooth-like coefficient of thermal expansion improves its staying power and helps maintain the seal. Because it needs no mechanical retention or bonding agent, it's great for treating non-carious lesions or surface abrasions. Calcium and phosphate ions are present in the saliva. GC Fuji Triage is a uniquely smart material. When Triage is placed on the tooth, it has a semi-permeable skin, allowing calcium and phosphate ions to pass through to the tooth, while keeping out acid and bacteria. The calcium and phosphate react with the fluoride that is released from the Triage. This improves the likelihood of remineralization of the tooth, strengthening the enamel as it matures. After trituration, working time is approximately 1.5 minutes, reaching a complete set at about 2.5 minutes. Triage Pink has a command set, allowing the operator to accelerate setting time by curing for 20 to 40 seconds with a standard dental curing light. The material does not photopolymerize. It speeds up curing time by absorbing heat from the light. This saves time and increases office production. This feature is not available with Triage White. In addition to pit and fissure sealant procedures, Triage can be used as an intermediate restoration. It can be applied to carious lesions and surface defects to minimize sensitivity and improve the oral health of the patient until a final restoration can be completed. The advantages of using triage in these applications are the high fluoride release and ease of placement. In between root canal visits, triage can be used to seal the root canal access preparation. It provides a protective barrier between the oral environment and the root canal, effectively sealing the access prep from bacteria and food debris. This is critical as the root canal must be clean and dry when the patient returns for the final root canal filling appointment. With triage, there's no mess and no fuss. Perfect mix every time. GC Fuji Triage comes in ultra-convenient pre-measured capsules. Simply tap or shake to loosen powder. Depress the plunger. Then triturate in a high-speed mixer for 10 seconds. Load the mixed capsule into the applier for simple, direct delivery. The starter package contains 50 capsules of Command Set GC Fuji Triage glass ionomer sealant and surface protection material, 1 capsule applier, 1 bottle of cavity conditioner, and 1 bottle of Fuji Coat LC. Let's review the key advantages of GC Fuji Triage. It's a simple-to-use pit and fissure sealant. There is no need to etch or bond the tooth. No need to isolate and dry the tooth. It's available in white or pink. Triage Pink offers a visual indicator to monitor tooth growth and sealant wear. Its self-bonding ion exchange creates a strong fused layer to enamel, even in a wet field. Triage provides maximum fluoride protection, up to 24 months fluoride release, and strengthens enamel by improving the likelihood of remineralization. When you begin using this fluoride-releasing breakthrough product from GC America, you won't just seal in the pit and fissures. You will supercharge your patient's teeth with GC Fuji Triage fluoride protection.